All right, that's the background to our story. We also know that Ebola has broken out again in the Democratic Republic of Congo. We have Dr. Tuyi Mebawondu with us right here in the studio. Good morning, Doctor.
Good morning.
Good morning.
Now, before we even go into the issue of meningitis that we have discussed before on the program, the new one now is the Ebola in Congo. What's really going on?
We know that the Ebola outbreak is a recurrent thing. We wait for some time and then we see a new strain coming out, and then we have to actually, rise up against it. We sounded a warning the other time that may not be the last Ebola we're going to be seeing. And then, for me, the only surprise is that it's coming too early. We had expected that with the effort we put, in place in the last epidemic, or pandemic, so to say, we'll have seen the African countries rising to the case and ensuring that we're able to manage, and prevent the current outbreak. But the good thing is that now we're wiser. We've learned a lot of lessons, hopefully, and then we should be able to curtail this Ebola and minimize it to that Congo area. Of course, we remember that Ebola came from Congo all the while. So we just hope that this time around we'll be able to curtail it and prevent the spread like it happened the other time.
Something in the water of Congo is really...
Yes, the bush of water of Congo. So many things come out from those bushes. Again, and it's a sad reminder that, again, Africa has not been able to put in place a robust structure to manage this kind of epidemic outbreaks, not just Ebola. We know the case of meningitis, polio will come around, measles will come, cholera will come. So we've not been able to put in place a robust system to manage our health system. And then the essence of putting up a Center for Disease Control for Africa, we hope we'll be able to address that. But again, if you are trying to manage across board an inefficient system, it will also be inefficient system. By the time you add inefficiency to inefficiency, you can only get inefficiency.
The report we got is that this outbreak in Congo is happening within a particular rural area, which many people have asked, why are the campaigns of Ebola too elitist, even for the hinterland people to understand and take caution? Now we're back to where we started from, and the campaign now will still be elitist, and years back it will start again from the rural area.
Again, you see, it's sad because we have essentially neglected our rural areas. Essentially. You'll be shocked what is going on even in Lagos when you move away from the main cities. Because people look at Lagos as just this place we see and drive cars around. But we've forgotten that Farasime is in Lagos. We've forgotten that a place like Oriba is in Lagos. So if you get to those places, you'll be amazed. You'll be amazed the level of, lack of health literacy, lack of infrastructure, and even the fact that people cannot reach to health facility on time. Now, for us, we need to be able to apply a simple technology, like even a short code messages that can help people get to the rural area. We must be able to incorporate what is local to the rural area, like the religious organization, like the town leader, like the village leader, to be able to pass some core messages around in terms of these things. We must be able to look at those core behavior that actually promote the spread of these epidemics. Sometimes it has to do with climate challenge. Sometimes it has to do with deforestation. So, and some of the time it has to do, most of the time it has to do with our habits, as you know, in this area. Until we sincerely address the rural health system in this country or around Africa, we're not going anywhere.
All right. Well, we played a report earlier on that you were there. You talked about issues. You mentioned the issue of corruption when it comes to strategies of tackling the meningitis vaccines and all of that. Can you break it down? Can you make us understand some of the things that go on that make us not be able to handle some of these outbreaks?
Let's situate it like this, Mike. Now, if you look at the whole country, we need about 21 million vaccines. Yeah. Okay? Out of that 21 million, WHO is bringing 500,000. Okay? And then there's a promise from UK, 800 and something thousand doses of this vaccine. So we've seen it all. We've not gotten 1.5 million out of 21 million vaccines. Now, even the 5 major states that were affected, if you add their population together, is close to 20 million. Okay? And then you now see that the vaccine need in those states exceed what we are getting. So this is a function of demand and supply. There's a high demand of the vaccine and the supply is in short is in short. So at the end of the day, what you see is that all sorts of things will come into that managing that vaccine, okay? Now, unfortunately, we cannot manufacture our own vaccines, either at Jos or in Yaba. We can't manufacture our own. So the one that comes will now have to be, scrambled over by people. And then the also bad thing is that our weak health system, the weak health system we run in this country will not allow smooth distribution of that vaccines. We'll see that, when you have people, like I already mentioned, that are poorly remunerated, when you have people that are looking for ways, they have not been paid salaries for a number of months, what they do is that whatever they have, they want to maximize it and grab it to be, to sell, to raise money. The second aspect is that the Nigerian Center for Disease Control needs to actually put a thorough thing in place to ensure that if the vaccine is going out now, we have to account for the empty vials or the vaccines when it's used. We cannot just again say that we're giving the vaccine and take a backwalk. Now, we need to involve the locals in terms of managing the vaccines.
Yeah, I was going to say, won't this control center be stretched thin if they have to be everywhere?
Yes, we need to involve the locals. So we say that, okay, the head of this place, the head of this hospital, the medical officer of health, we have this number of vaccines for you. It
is mandatory now for core members to show a certificate of vaccination. I haven't been vaccinated against the meningitis, at least if you're going to the flashpoint area. And these students are scrambling to get vaccination. And sometimes they have to now pay extra money to even get vaccinated. Whose responsibility should that be, really?
Actually, when you deploy people for national service, their care in terms of health, feeding, provision, security should be in the hand of the government. I served in Jos those days, and we were aware that government must be able to do all those things for us. They're going to just put all this copper under unnecessary stress. What we're looking for is that even before the deployment to those states, they should have been able to tell them as they're coming to the state where to get the vaccine. It would have been nice for them to organize during the camp a section for them where they can get those vaccines easily without stress. Now, if you now put pressure on them to get the vaccines, of course, trying to get it at all costs will mean that they have to pay extra money. They mean they have to go extra miles. And then it means that the possibility of people having fake vaccines administered to them is going to be there. These are very highly specific products that must be administered in a place where we're sure that that is what's being given. So you cannot then open and give the charge to the NYSC inductees to go and look for the vaccines everywhere. I don't think it's proper. We should have, moved those vaccines to where they are in the camp. As they are arriving the first, second day, we're giving them the vaccines, and then before we continue.
So look at a scenario where some of them will go to the camp without without being vaccinated. And I'm looking at the ripple effect of it, and they leave the orientation camp and they go back homes, and the chances of spreading what they'll contact from where they are coming from, isn't it higher?
Again, we can sit down here and talk a lot about the challenges of the health system in Nigeria. And again, we also appreciate the fact that the foundation of good economy is good health. And we saw the damage economically the Ebola epidemic did to us. We even know that even this meningitis epidemic, is costing us a lot of money, since we have to pay as much as $50 per dose of the vaccine, and you can multiply by 20 million and see what the arithmetic will be like. And then we also see that even apart from that meningitis, we have to immunize against polio, it costs money. We have to immunize against measles, it costs money. We have to prevent cholera, it costs money. But so now, at the end of the day, we need to be able to put in place a proper check that we're able to ensure that people get those things as when it's due. Now, the danger is that, because of the movement, the high movement now, is that, you pick this jam here, you take it elsewhere. You remember how the Ebola came to Nigeria. Yes. Somebody just flew in, and all of us had to be panicking. And the thing now, moved to Spain, moved to America, move around the world. So for us, I don't see any justification that will now put pressure on the NYSC inductees to now have to go and look for vaccine by themselves. It's a danger not just to them, it's also a danger to people that likely come in contact with along the way.
All right, the Nigeria Center for Disease Control is an agency set aside to look into all of this and take proactive measures even before the outbreaks. Now, we see that the agency is obviously overwhelmed. Now, moving forward from where we are now, when the outbreak was, when we had about 300, 400 deaths, they said no problem, we'll try to ensure it doesn't climb. It climbed to 700. Now we're talking about 1,000.
Over 1,000.
Over 1,000, 1,067 as the case may be. What can any other person, either government, state governments or other ministries, what can they do to help the Center for Disease Control in this case?
Again, this challenge of reactive vaccination is always there. You know, we react, we're not proactive about our intervention. Because we know that, again, meningitis will come. Whether serotype A or C or anyone or combination, it will come again. So our prevention should just start from now. You know, we should be able to put it in place because you know the meningitis causes as much as 16 countries. You know, more than 500 million people. Now, what we need to do, first and foremost, is to be able to deploy appropriately what I call health literacy to the local level. Okay. If we have mosques in those areas, we should, recruit people from there to tell people what they need to do to prevent not just meningitis but some diseases. Clear cut. We're not deploying health literacy to the local level as much as possible. Secondly, we've seen that the part of government that should be involved in doing that is just like a vassal. It's just an attachment, appendage of other bigger government. We're talking about the local government. The local government is supposed to take charge of those basic things in terms of campaign to prevent diseases and even to detect those diseases. The medical officers of health in those places are not working. Thirdly, the human resources for health is not just there. Now, we're looking at reports on Zamfara, whereby, you know, out of the 1,300 health workers they have there, more than 80% of those workers were quacks. They didn't qualify. So we're seeing about 300 health workers treating a population of 4 million. That would not work.
So for a long time, we've really concentrated on the issue of vaccination, leaving out the personnel that will administer this vaccine, leaving out issues of even laboratory supplies, because do we really have that?
Yeah, but again, because now for you to pick meningitis, you must do your surveillance, you must match it with a proper laboratory diagnosis. Okay, and then you must respond by deploying health workers, because it takes some skill to do lumbar puncture, for instance. You know, where are you going to get the health workers to do all these things? And then, you know, we've now abandoned, you know, the health system. Now, to the extent that even we need intervention, we have to look for Medicines Sans Frontières from abroad to come and help us, you know, give those vaccines. Because let's look at it. We're not even doing the proper budgeting and network to ensure that, you know, our health system runs and works as it should be. And then government itself, because another challenge is that government itself now needs to actually do some other things. We need to provide proper nutrition, because that belt also has a lot of malnourished people. We have to provide proper nutrition for those under 5 children. We have to provide a decent housing. Even if you are going to build your hut, we must be able to make specification. This is your hut, must be built in this way, so that we can have aeration. Now, if we are experiencing overcrowding, especially in the meningitic belts and time, you know, when the spread is on, a simple face mask to prevent you from inhaling those things. These are the simple things you can deploy. What is wrong in putting, you know, soap and water at the corner in a school for children to, when after playing for some time, to wash their hands? These are basic things that can happen at the level of local government. What we tend to do is to sit down and look at the end result and start acting reactively. What will Center for Disease Control, Nigeria Center for Disease Control, what will they do? How many staff do they even have? How many doctors do we have in this country? How many laboratories, technology do we have in this country? How many children are doing science in this country? You have to do science to get all those things. What investment are we putting in the education to ensure that children do science and encourage them, you know, to do health stuff? All
right, Dr. Tuyi Mebawondu, thank you very much for coming on the program. We'll keep talking about this as we get along, because until the meningitis is put behind, we can't stop talking. Thank you for coming.
Until epidemics is put behind.